On the right on Sirius XM Patriot 125.
That's right. It's Stacy Washington here, and we're so glad to have you. Also, wonderful to welcome in Ambassador Andrew Bremberg, former assistant to the president and former director of the Domestic Policy Council. Welcome in, sir.
Thank you. Great to be with you.
Great to have you back. You have written a Fox News opinion piece entitled 3 Steps That Could Stop Fraud and Make Healthcare More Affordable for All Americans. This is such an amazingly prescient topic. Americans are exhausted by the idea that you have to spend basically the price of a new Toyota every single year, and you still have a $7,000 deductible. And the costs are just higher and higher and higher. Skyrocketing. I just went and had blood work done, and I paid, to have the appointment. They make you pay a little deposit up front at the to get your lab drawn. And then afterwards they send it off to your insurance, and the insurance is like, oh, she's under deductible. So in addition to paying, I don't know how many tens of thousands this year annually for, just to be in the plan, I have to also pay an additional $7,000 before they start covering things, unless it's preventative, which that's just one visit. Like that's just one doctor's visit. She might order blood work. So, yeah.
Yeah, well, you hit the nail on the head. I mean, Americans are getting crushed by ever increasing healthcare costs that are going up and up and up every year, and we never see exactly why that's happening. And it's because no one knows the price of what anything costs. Just take the great example you just gave. You gave of going to get some blood work done. This is not an emergency, right? This is something you could easily shop around for, like you shop for other things. And I bet you didn't know what the cost would be before you got the service. And this is the biggest problem. We want to have free market healthcare in the United States, but unfortunately we don't, because we don't know what the prices are. And this is something that President Trump gets, and that his administration in the first term and now in the second term are taking steps to address it, and can do even more to ensure that Americans are protected and can actually lower healthcare costs.
So, in addition to transparency, and I mean, I'm here for it. It's the only thing we don't shop around. That it's so weird, because when you say I could have shopped it around, well, there's only Quest and LabCorp, right? I mean, I don't know of anybody else who does blood work. So between the two of them, and they don't really, like when you call over to get this kind of stuff, like to say how much is something going to cost, you almost get this feeling that the employees are kind of like, what's wrong with you? Like, what do you mean? How much is it going to cost? Don't you have, they'll say, well, do you have insurance? And you're like, well, yeah, I mean, I do have insurance. And then they're like, oh, okay, well then, what's your deal? You have insurance. I'm like, well, I'm still under deductible. And they don't really want to know your personal information. They don't care. So,
no, I know.
Yeah.
Well, and so many times, I or others have talked to a doctor and said, like, or how much is this surgery? How much is this service going to be? And I think they're answering truthfully. They say, I have no idea. Who has no idea what the cost of this service they're selling is, right? I mean, this is absolutely ridiculous. And unfortunately, we have a system that's grown up and has now basically been designed to maximize, I'm sure you hear the phrase revenue cycle management, basically how at different steps along the way, different interests can extract more money out of patients or their employers that are paying for their health care frequently through their health insurance premiums, and just extract more money because of the lack of transparency, and that because people don't know what the costs are, they can't shop for it. And critically, they don't know the price of the care they're about to get, which, this may shock you, is actually against the law right now. One of the important laws President Trump signed in his first term, at the very end of his first term, was a requirement that for any time you had scheduled care, you could get the price of your care in advance. I'm sure you and many of your listeners have gotten what is called an explanation of benefits after you got your care. It tells you how much was charged and what your deductible was and what your copay or co-insurance was. But the law signed in 2020 said that you should get that in advance if you ask. And unfortunately, that law was supposed to go into effect January 1 of 2022. And here we are in 2026. We lost 4 years in the Biden administration who did literally nothing to protect patients on this. And we need to get this done. I think this is something critical that the president can see done, that will not only protect patients, but also help patients ferret out fraud across the healthcare system. Because, who knows what these, explanation of benefits say in terms of all sorts of charges that show up there that patients frequently say, I never saw that. What the heck is that?
Right. Or you stay in the hospital. That happened to me. I stayed in the hospital and there were things on my explanation of benefits. And I was like, when did that happen to me? When did these? Right. So I went back and I asked, and they actually took some stuff off. And then the other stuff, she said, well, we did this to you, but it was all in one, like we came in and you might have thought, oh, I'm just getting some blood work drawn, but we did all of these things. And I was like, did you?
Right.
She said, yes, we did.
I've worked in the healthcare policy space almost my entire career, and this is one of the things that drives me crazy, is that people will say, well, healthcare is different. Healthcare is complicated. People are too dumb to shop and all these sort of things. And that is such nonsense. Now, it is complicated. No, I'll be clear. I'm not a mechanic. I don't do my own car work. I'm not great at handling a car. But I can bring a car to a mechanic and I can say, I'd like you to check on this. And they say, okay, well, we're going to look at it. And here's our price or estimate up front. And we're going to do this. And we're going to go, I'll go ahead and, realign all your tires and tell you if you need new ones. And I'll say, well, I, as a consumer, will ask a question. I will say, oh, well, what are you doing? Why are you doing that? The exact same thing can and does happen in healthcare. It's just we just pretend that we kind of, treat people that they have no clue what they're doing, that they can't, ask, oh, I got an estimate in advance. And you could see on that, but like, oh, what are all these weird tests you're running? And you could ask that in advance. And they'd say, actually, it looks like a bunch of different tests. It's really all just one test, and we're going to do it when we come in later. And, the exact example you just gave, all that could have been disclosed and explained up front. I mean, you don't have to treat us like we're idiots, right? But the issue is once they do that, once they disclose that all up front, the ability to kind of upcode and game on the payment side of things after the fact goes away. Because if you've gotten a price or an estimate up front, of course, maybe something might change because the care actually is different. Lots of times I'll bring my car to the shop and they call me and say, hey, we looked at it. It's not just new brake pads. You need a whole set of new brakes. Okay, fine. The exact same thing can happen in healthcare all the time. It's just, unfortunately, we've not been protected by the largest health companies in the country, by the laws that Congress actually passed.
Yeah, it's kind of disconcerting to hear you say it's already passed legislation. But can I just point out, first of all, you mentioned cars. On my car, I don't just get an estimate. They send me a video, and a technician walks around underneath my car and points stuff out. And then as he's pointing it out, he describes what he's going to do. And then he tells me that will be, and he tells me the price. Then in my email is the video that I'm watching. And there's also a price breakdown. I get to go through the email and select in click boxes what I want to get. It takes me to a website. I select the boxes that I want. I leave off the stuff that I don't. And then I approve it, which means when I come pick the car up and those things are done, I plan to pay that amount. I know what the cost is before I get there, and I know what I've selected. And the other place where they do this for me is the dentist. Now, they don't send me a video of my mouth. They just send me you need this. This is what we're going to do to you if you let us. Here are some alternatives if you don't do this. We recommend that you do everything. Because, at the dentist, there's never anything that's optional. But they do tell me beforehand. And you know what else they do? They submit everything that they're proposing to my medical insurance, which always denies, and to my dental plan, which then will tell me, under your plan, we cover this percentage. And they send that back. And then they send me another one that says, now that we know what your insurance pays, here's the amount, patient responsibility. And then would you like to schedule this? And I even get phone calls on that. So everybody can do it except the hospitals who make the most money. They make the most.
That's right. That's right. The largest increases we've seen in healthcare over the last 20 years and just over the last 10 years have been the rising cost of hospital care that has just gone skyrocketing through the roof. And is another one of the reasons why we need to make sure that we have access to advanced explanation of benefits before we're hospitalized for planned care or surgeries or anything like that in advance, and why we need to have better prices and enforcement of the price transparency requirements out there that hospitals are supposed to be complying with right now, and unfortunately frequently don't.
Now, if you're having a big surgery, they usually do tell you, that you're scheduled and your insurance has already kind of worked things out. It's usually on the smaller things, or if you need a CT scan, you assume that the CT scan is going to cost, I always think it's going to cost like $650 or something. It always comes back at like $2,200. This is a machine that they've literally already paid for because hundreds of people have been through it and used it. And they're still charging $2,200 for you to slide through this machine. Now, admittedly, it's I think it's like $400,000 or $500,000 now. It used to be a $90,000 machine, but now they're much more expensive. But they have thousands of people using it every single month. So why are they still charging $2,200 for each? It's just...
No, because they can get away with it, and they don't actually face competition. There are imaging centers, probably not far from that hospital, that you can get it for a fraction of that amount. But the problem is there's no competition going on, and as patients, we aren't given the prices and aren't given the option to shop and realize, wait a minute, I can go get my imaging test done over here and save thousands of dollars compared to going over there. Absolutely. And another big part of that is that so many of us get our health insurance through our employers right now that are the largest purchasers of private care in the country right now. And that unfortunately our employers are getting robbed as well. They don't have access to the dollar amounts that they're spending on claims, and therefore they don't help build better benefit options that incentivize us to shop around and get the cheaper CT scan rather than the one done inside the hospital that costs 5 to 10 times as much.
So it doesn't feel right that the people that we trust with the most substantial decisions that we're making are kind of grifty.
Oh, no, I absolutely. And let me say, I think a lot of the incredible, doctors and nurses that are actually frontline delivering the care, are they dedicated to helping serve others. And I think by and large, they do a really great job. It's the business structure that's creeped in around these hospitals and insurance companies where you have extremely large administrative staff now that are designing systems to extract more money out of us, the patients, and out of our employers who pay for a lot of the health insurance. And that type of structure has grown up in a way that's not, added value. It's there just to, keep pulling more profits and more dollars out of the system. Nothing wrong with profits. I'm all for profits, but it's got to be done in a market-oriented way where you compete and you're rewarded by greater profits by providing a better service at a lower cost, right? And that's not what's happening. That's what's broken in our healthcare system right now.
So if we've passed legislation and it's still not happening, what's it going to take to get this actually enforced?
Yeah, well, that's why I'm excited about President Trump and his leadership this second term. They're reinvigorating the enforcement of price transparency rules right now. They're in the process of that, so hopefully we will see that take place very, very soon. They're also working at the Department of Labor to implement new regulations that would enhance and strengthen employer health insurance. This is something that's been gone by the wayside for years, that no one's paid attention to. These large employer plans that insure upwards of 160 million Americans are getting really hammered right now. They're seeing double-digit healthcare costs go up every year, which directly just comes out of wages. I mean, the lack of wage growth we've seen in a lot of jobs right now is directly correlated with the fact that the health insurance costs keep going up so high. So there's a new regulation that the Trump administration is working on, and we're hoping that will go broader than just trying to tackle the issue of pharmacy benefit managers, which is an important issue to tackle, but to cover that and the entire health plan. Hopefully, if the Trump DOL goes big, that'll see serious wage gains for Americans in the next several years by driving down healthcare costs and empowering employers to actually shop and do a better job managing their healthcare spend.
Okay, so I do like the sound of that, and I know there's much more to be done in the way of healthcare reform, but just to have that law that's already on the books actually being enforced, it would make a huge difference for Americans. And I almost feel like we need some kind of training council where when you sign up for healthcare, but maybe not from the insurance company. You get some kind of training on. So this is what you got to do. You got to shop your stuff around, right? Yeah, just shop it. Just somebody to tell you, shop this thing around.
Never pay the first bill. Right now, never pay the first bill. That's the thing that everyone who's gone through the healthcare system has learned, is that you need to challenge the first bill that you get, particularly for any serious, complicated care, because they've loaded it up with all sorts of charges. But hopefully, if this law is implemented and you actually get a price up front, and then you get a bill and they match, then you'll be set. Just the other thing that I think is a big opportunity is that even though Congress passed that one law several years ago, Congress is also working on passing a law right now, being driven in the Senate by Senator Marshall, who has bipartisan support behind it, called the Patients Deserve Price Tags Act, that would really strengthen all of these requirements and make sure that prices are posted, that they're accurate, and that patients are able to shop for care. So that would be a huge change to really drive down the costs of healthcare, which is of course the leading cause of cost of inflation and increases and all sorts of anxiety that Americans are facing right now.
So the thing that we have to be looking at, and I know there are plenty of people who hate President Trump, but I don't know anybody on the left or the right who likes the way our current healthcare system works, that they're completely happy with it. I don't know anybody who's in that position. Some of them are like, some people are like, well, I'm okay. They're relatively healthy. They don't have much going on. But most people have had at least some experience with the healthcare system, and they all feel it's too expensive. I don't meet many people who have a problem with the doctors or the nurses or the hospitals themselves. Like, it's not like they feel like these are bad places, but the costs and the way that you get charged. Like my favorite, and maybe you have some insight on this, this is the facilities fee. It's always something outrageous, like $675. And they can never tell me what it's for other than people in my position have to pay it. Not everyone has to pay it. And they just, it's the fee they charge me for walking into their building. They can't explain why.
And sometimes, it's sometimes not even really, quote, their building, in that you could, we've encountered patients that have gone to the same doctor for years, and all of a sudden, unbeknownst to them, the doctor practice got bought by the hospital system. And the next time they go to they made the appointment the same way, go to the same door, go to the same doctor's office, have the same visit. And on top of that, you get your $400, $600 facility fee charge all of a sudden. You say, what facility did I even go into? I just went to the doctor's office. And that's exactly what they're doing. And, look, I think that's ridiculous. Now, if you want to say to all your customers or patients on the front end, hey, whenever you walk through one of our doors, there's a $400 or $600 facility fee. No, I may not like that, but fine, it's at least transparent. But the fact that it's a surprise fee right now is just what's so outrageous. And, every American is being harmed by this every single day. I mean, medical debt is one of the leading causes of bankruptcy. People forego getting care because they're afraid of what the bills and costs are. This is the United States of America in the 21st century. We are the greatest country and the greatest economy in the world. We can do this. And my big, message and point and, frankly, fear is that if we don't do this the right way now, by unleashing the markets and real prices, in the not too distant future, when the politics change at some point in the future, there's going to be another run to try to put us into a single payer healthcare system, because Americans are so fed up with the dysfunction in our healthcare system, because the cost drivers, that we may end up there. So I think this is the real moment right now, both with the Trump administration and the Republicans in Congress right now, to take meaningful action to really fix what is at the core of the problem of our healthcare system, which is these out of control rising costs. And we know what fixes that. Price transparency and free markets help bring down prices.
Yes. And, what I learned when I got that facility fee is I thought, well, I came to the ER and I didn't even get put into a room. They saw me in the hallway. They had little beds set up in the hallway, and they had a like a curtain, but it's like not a curtain. Yeah. Well, it wasn't even triage. It was just the curtain that they move. It's on like its own legs, and it basically gives you the illusion of being private. So I never made it into a room, and I was charged a facilities fee. So what I learned is that if I go to an urgent care, branded by the same hospital or otherwise, Not only can I make my appointment in advance and not spend any time in the waiting room, but I don't have to pay a facilities fee. And the urgent cares are extremely transparent with their pricing. Like they tell you everything you're going to pay when you make the appointment. You can even put a card on file. So I don't go to the ER anymore. Exactly. I mean, obviously I would if I was in a like a ambulance, I would. Right. But if I have any control over myself, I'm just going to go to urgent care so I don't have to pay the $600 facility fee. I'm getting in and out with $150.
Right. Well, and that's the whole point. Our entire healthcare system can be just like that. Like this is not reinventing economics or just trying to do something crazy that's never been done before. This happens in some sectors within healthcare, right? I mean, our entire economy runs on the same principle. And in some sectors of healthcare, like you said, dental, urgent care, like LASIK surgery, and there are actually some free market medical centers that run by just sticker price, where they say here's our prices for our surgeries, and that do really incredible work. So this is something that can be done, and we just need the collective political will to force the system to change to ensure that we're going to protect patients by giving them prices up front, and that will lower the entire cost of care.
Okay, well, you have enlightened us a great deal tonight, and I feel like we have a few more things we can actually implement to save ourselves money, especially that first